Our every thought, feeling, and action is controlled by our brain nerve cells that communicate with each other through regular electrical impulses. These impulses travel along a network of nerve cells called neurons with the help of chemical messengers called neurotransmitters. So what happens when a brain nerve cell misfires, generating a sudden burst of uncontrolled electrical activity within the brain? A seizure begins. Epilepsy is the most common brain disorder, affecting approximately 50 million people worldwide. This disorder of brain function results in recurring convulsive or non-convulsive seizures and momentary lapses of consciousness. With 15 different seizure types and over 30 epilepsy syndromes, 10% of the population are at risk of experiencing a seizure, while 3 to 4% will go on to be diagnosed with epilepsy. There are many causes of epilepsy, including a lack of oxygen to the brain after birth or after a stroke, structural abnormalities of the brain, or it may occur following a serious infection such as meningitis. While seizures may be triggered by a variety of things, seizures are unpredictable and episodic. They may occur as frequently as every day or may only occur occasionally. Most seizures will stop without intervention. Due to the unexpected nature of seizures, it is important for those with epilepsy to be able to control their seizures to reduce their chance of injury or death. Anti-epileptic drugs, or AEDs, have provided 70% of epileptics with some control over their seizures, where after 2 to 5 years of successful treatment and being seizure-free, medications can be withdrawn in 70% of children and 60% of adults. But how do these medications work? Before we look at how AEDs regulate seizures, it is first important to understand ions and ion channels and what happens in your body during a seizure. Ions are positively or negatively charged atoms or molecules. Ion channels are proteins found in a cell's membrane that acts as a pore, creating a small opening that allows a specific ion to travel through. Ion channels are important for many reasons. However, in particular, they allow the transmission of nerve signals, known as nerve impulses or action potentials. So what are AEDs? AEDs do not treat epilepsy and cannot stop a seizure once it has started. However, if taken once to twice a day, they can prevent seizures from occurring by altering and reducing excessive electrical activity within the brain. AEDs are taken orally and enter the stomach, where the digestive juices break down the tablet to release the important medication. This passes through the wall of the gut and is further absorbed into the bloodstream, so it may be distributed around the body and carried to the brain. So what happens in the body when a seizure occurs, and how do AEDs prevent these seizures from occurring? Today we're going to focus on the role of sodium ion channels and calcium ion channels in epilepsy and look at how AEDs interact with these channels to prevent seizures from occurring. Sodium ion channels are found in the membranes of nerve cells known as neurons and are primarily responsible for how electrical signals are sent from one nerve cell to the other. As sodium ions enter the cell will depolarize, causing an action potential, which involves the communication of a message from one nerve cell to the other. When this message is complete, sodium ions will exit the cell, allowing the cell to repolarize. When a person has epilepsy, a portion of the sodium current fails to inactivate when it has received the message to do so, causing repetitive firing of the sodium ion channel and continuous action potentials, which results in a seizure. AEDs bind or attach themselves to sodium ion channels. This stops the channel from becoming activated and producing an action potential. As such, AEDs stop the neuron from sending repeated messages, preventing a seizure from occurring. Calcium ion channels are involved in sending messages from one neuron to another. Calcium ions are second messengers. That is, when they enter a nerve cell, They signal the release of a neurotransmitter which travels across the synapse, the gap where two neurons meet, carrying the message to the following nerve cell. In the case of an epileptic, specific T-type calcium ion channels are opened by a small depolarization of the cell. These channels facilitate burst firing mode, causing rapid firing of nerve cells, resulting in a seizure. AEDs work by blocking calcium ion channels. As such, they stop the release of a neurotransmitter, preventing excessive electrical activity in the brain, stopping a seizure from occurring. However, these AEDs still fail to control seizures in 30% of patients, so it is important that research is continued. Xenon Pharmaceuticals has recently reported the expansion of its ion channel neurology project, which targets potassium ion channels to stabilize nerve cells and reduce action potential firing. A clinical trial is going to be run at the end of the year, and it will be interesting to see what the future of anti-epileptic drugs holds.